Pap smears are a test for cervical cancer. They now recommend that we only start screening for cervical cancer at age 21. So that means you should not have a pap smear before age 21, except for very rare exceptions to that rule. The new recommendations state that you should get a pap smear every 3 years from age 21 to 29, assuming all your pap smears are normal. And then at age 30 until age 65, they actually recommend that you only get a pap smear plus an HPV test every 5 years. Again, assuming that you have no other risk factors and all your other tests have been normal or negative to this point. The new recommendations are because changes that lead up to cervical cancer are very slow. And so they've found that by doing it every 5 years, they can still catch severe dysplasia and cancer in that amount of time and provide treatment. Based on each individual patient's medical history and gynecologic history, there are a lot of reasons that they may need to be tested more frequently. And so it's important to talk to your doctor about your history, and they may suggest more frequent pap smears. Even though we are recommending spacing out pap smears, we do still recommend getting an annual exam with your gynecologist every year. And this includes a breast exam and a pelvic exam. The pelvic exam is very important. We're able to look at the cervix and see if we see any changes that might be concerning. We also are able to evaluate the uterus and the ovaries during that time. So it's a very important exam to have done every year, even if you're not having your pap smear performed.